I think all of the representatives from philanthropy in the room would attest to. It's been very rewarding to see what's unfolding at the coordinating board, and it's another one of those things that gives me hope for the things that are ahead. One of the themes that consistently emerges in the work with mental health and well-being is the essential importance of collaboration and partnership in the work. These are values that you heard coming through with the commissioner's remarks and with Dr. Rhodes's comments as well. And I'm confident that our keynote panel will harmonize with and build on these ideas as well. And to that end, I'm delighted to introduce the discussants for our next conversation, all of whom bring a national lens to the challenges and advances in post-secondary efforts to improve mental health. First up is Sakshee Chawla, Senior Policy Analyst for the State Higher Education Executive Officers Association, or more commonly known as SHEEO. From her perch there, Sakshee has the opportunity to see what works in various statewide approaches and how that knowledge might be shared or replicated more broadly. I've had a chance to get to know Sakshee a little bit over the last several months as part of a 5-state learning community on mental well-being in higher ed, along with the Jed Foundation and originally supported by our colleagues at the Lumina Foundation. Which brings me to the next panelist, Dr. Zainab Okolo, Senior VP for Policy, Advocacy, and Government Relations at the Jed Foundation, the programmatic partner in the learning community with SHEEO that I just mentioned, and a friend that I've known since her time at the Lumina Foundation, working specifically on the issues of student mental well-being in higher ed. What I always appreciate with Zainab is that she brings her clinical background and experience as a lens to this work, and she has just the exceptional ability to describe and define the challenges that we face without sugarcoating them, all while cultivating the optimism and energy that we need to address them creatively and effectively. My newest friend in this space, Dr. Sunny Patel, serves as Senior Advisor for Children, Youth, and Families in the Office of the Assistant Secretary at the Substance Abuse and Mental Health Services Agency, or SAMHSA. Dr. Patel also brings tremendous clinical experience and perspectives to help shape policy and practice at the federal level. And in less than 5 minutes talking with Sunny, you understand the depth of his commitment and passion that he brings to this work. And finally, fittingly, Dr. Mark Milliron, our immediate past board chair at the Trellis Foundation, will serve as a moderator for this esteemed panel. As a president of National University, Dr. Milliron maintains a coast-to-coast perspective serving 40,000 students actively pursuing degrees and credentials nationwide. As long as I've known him, Mark has always acknowledged the institutional responsibility to serve students holistically. He's been a champion of Trellis Foundation and other funders' work in blending data and analytics to inform holistic approaches to student success. It's a joy to have Mark facilitating this amazing panel, so please help me welcome them all to the stage.
We have such a wonderfully rowdy group of conversants here. This is going to be fun. The really powerful thing about this work happening in Texas, but also happening nationally, is, and as Commissioner Keller really talked about, this idea that people have realized we had challenges with mental health before the pandemic. It has only been exacerbated and extended beyond. And it also comes in the context of a large body of research that has come together out of the foundation work in student success in higher education and institutional research that has made it clear that for a long time we had focused far too heavily on academic solutions to completion challenges, when we always knew that suddenly that we had this family of DEI, SEL, basic need, and mental health challenges, and we really, in many ways, have a national challenge to figure out how do we create healthier learning environments for our kids and for our adult strivers in the world of education. We love having you in this mix, and what I'd love to do, maybe Sunny, is I'd love to maybe start with you. This priority around mental health in the world of higher education is coming coming loud and it's coming proud from lots of different corners. How is your administration really prioritizing this? Because the focus on this in higher education in particular has become pretty acute.
Sure. Well, one, thanks for having me. And I can start from the personal and maybe zoom out a little bit. Yeah. I've been deeply committed to higher education. One, from when I was a student, but I've served on the faculty at UCLA, at NYU, at Harvard College, and most recently at Johns Hopkins. And I've dealt with students and their needs in every place I've taught. And it was, one particular moment at a graduation where a parent had come up to me and their child had gone through some challenges when they were a sophomore and they were graduating as a senior, and they expressed their thanks as being someone who helped their child through these really tough times, to be that person in their life. And so, it's been something that's highlighted to me personally, and how important it is for all the other metrics of success that we look for. Mental health is at the top of the administration's domestic policy agenda. I would hazard it's one of the few bipartisan issues in town that we see across this country. It's at the top of the National Governors Association agenda, and I think we have a unique window of opportunity to act. I don't say that just as a child, adolescent, and adult psychiatrist, where I see patients. I don't know if I've ever been a cool kid, but it feels like we are cool kids at the table now, Often it would be at the bottom of an agenda. It's wow, we're pretty far up, it's nice. What's the administration doing? There's a whole of government approach, and I really mean that. Yeah. Upcoming, there's going to be the National Suicide the National Strategy for Suicide Prevention will be coming out shortly. Student mental health and higher education is really a key strategy there, right? It is a foundational piece of work that SAMHSA has been advancing for almost 2 decades now with the Garrett Lee Smith campus suicide prevention work that we do in probably many of the communities that you represent. The Department of Education has had a major push. We put out a request for comment. They put out a request for comment last year around what should we be prioritizing and really learning from the community. And there's going to be a convening next week called Raising the Bar, which I imagine some folks in this room will also be at in DC. And then 3, it's really been upfunding programs. And I think some of that has happened in the midst of COVID relief, but there have been subsequent iterations of funding throughout the last 4 years of this administration where we've been able to expand many signature programs. Yeah. And we're at a point in this term of the administration where we're seeing the fruits of that labor come out. So it's not just been rhetoric, but funding and then programmatic sort of expansions.
Oh, I love it. And Zainab, I'd love to bring you in on this because being in the Trellis Foundation board conversations, and Kristen and her staff and our fellow board members, as we looked at our strategy to try to help more and more diverse students be more successful in the state, one of the things that became crystal clear to us a few years ago was if we don't get a portfolio of work around mental health, there is no way we're going to be successful. We have to get into this conversation and make sure we're catalyzing some kind of larger work. And I know with the Jed Foundation, as you've really thought about the kind of reasons for jumping in, it can't just be you want to be with the cool kids, right? You want to be, my guess is you are deeply focused on this for a whole host of reasons. Just unpack that for us a little bit.
Absolutely, and I'll argue we've always been the cool kids.
Yeah.
Well, what's exciting is that we're in what feels like an inaugural moment where we're finally having a national conversation around mental health. And I'll take Dr. Patel's lead in just kind of sharing my bias. So having worked as a trauma-informed therapist for the past 14 years, having worked as an academic counselor on college campuses, one of the first things I recognized a decade ago in my role as an academic advisor and director was that students that did not have mental health supports on campus especially could not persist. And I worked with brilliant students that at the hands of anxiety, misdiagnosed or underdiagnosed depression, and bipolar 1, which I mentioned those three because those statistically are oftentimes the ones that are underdiagnosed or what are known as late onset. So when we have college students that come to campuses that are not diagnosed before the age of 14, they come to your college campuses just discovering their mental health challenge and needing resources. But the opportunity to get those resources was just not there because it wasn't prioritized. And instead of prioritizing mental health, we created stigma around it. And then we created tropes around that stigma to normalize behaviors that actually weren't normal. The overspending, the hypersexualized behaviors, the over-drinking, oversleeping on campus, those were cries for help, and our students were self-medicating for years because they would be accepted for engaging in those behaviors before they would be accepted for explaining that they needed help mentally.
Yeah.
And we're finally now having that conversation, which is really exciting. The Jed Foundation, being 25 years ahead of this conversation, has been working with campuses with our comprehensive approach to create a community and culture of care by which students do not have to carry shame, and by which our folks on campus knew how to have these hard conversations with our students. And what we're really excited about is that we know that by creating that culture, removing the shame and stigma, and by implementing key strategies, there are ways for us to get help for our students. So although, as you mentioned, and as we talked about from the first fireside chat, we all know that the pandemic exacerbated a lot of the issues, but it really, for me, brought to light the elephant in the room that we just refused to name. And now we're here having these really productive conversations.
Yeah. I love just the fact that we're having these broader dialogues. You think about it here, I mean, just up here in this conversation, we have the federal perspective is coming together. The foundation and intermediary world is coming together. Sakshee, clearly the states are now leaning in on this, and this is becoming an absolutely imperative conversation, and states are really trying to get ahead of this. Unpack that a little bit for us. Help us understand what's happening in your world.
Yeah, so I'm at the State Higher Education Executive Officers Association, and we work with the different state governing, policy, and advocacy organizations. And within this space, what we've noticed is that, when we've been talking about student success and equity and retention, the big sort of ingredient that's been missing from the conversation has been student mental health and well-being. Often we've looked at all of these academic measures of persistence and retention and success, but we haven't realized what are the factors that are influencing how students are showing up to the classroom, or rather not showing up to the classroom. And in this work that we've started in partnership with the Jed Foundation, we've really uncovered that with our learning community of 5 states that we're engaged with right now. No surprise, Texas is one of the states engaged in this work. Alongside Texas, we have Arizona, we have Pennsylvania, Oregon, and Louisiana. And we're noticing, very different states in terms of sort of the work that they've been doing before joining the learning community within this space, but then also just diverse contexts that exist across all of these states. But the theme around the urgency and the need to really think about this from a student success lens is very clear. This is not a topic that can just be a student affairs topic where one side of the campus is working on this and is very much so a siloed stream. This needs to be something that is very much seen as a part of the academic affairs, the student success agenda at an institution, at a state, at a system, and then embed that in viewing all other strategies. And I think we're at this moment, you prefaced that at the beginning, this has been something that's been bubbling up, but I think we're at the place where our states are realizing that they really need to be having spaces to engage in this work collectively. We need to, broaden what has been learned at the institution level and bring that to the state and system level. There's going to be need to sort of understand the context and the uniqueness of all of these spaces, but there's a lot of learning that can happen, and there's a lot of sharing that can happen.
I really love that perspective, because it really, in some ways, in some institutions and some agencies, there are folks who think mental health is somebody else's job, right? And now we're realizing, actually, the creation and fostering of healthy learning environments is kind of everybody's job, right? And part of this is us realizing, how do you create systems and processes, even funding models, that actually make the outcomes for a healthy learning environment more positive, right, in terms of what we're doing. Zainab, I'd love to bring you in because I know your foundation, your organization has been doing some research on some of the things that work, whether it's a combination of telehealth or how you act and how people understand social media and the host of other things. Talk a bit about how the research work you've done has informed the kind of advocacy and policy work that you're doing.
Absolutely. So our research, and by the way, we just launched our impact report that just came out. Jed team, was it yesterday? So definitely check that out. It captures the last decade of work, and we are so proud to boast about the impact that our impact framework has had. We're seeing reductions in suicide attempts, ideations, and completions on our college campuses. Nice. And for us, that really says a lot, because according to the CDC, suicide is still the second leading cause of death for children as young as 10, all the way up to the age of 34.
Wow.
I'm glad that enacted some deafening silence, because that's what we need to really keep in the back of our minds when we're trying to pass the buck on who needs to do what. Yeah. The urgency is in the now. For 10-year-olds to be feeling a level of despair as a result of, and we can trigger again the pandemic, but what we're really triggering is that we're dealing with a national cry out from a collective response collective trauma, that we all responded to. And the data is telling us that we don't have a choice but to engage in the conversation. One of the things that we get to do at the Jed Foundation is that we get to center youth experience and voice in the strategies that we work on in supporting institutions. And we also get a chance to really focus on where they bear a lot of community. So beyond our impact report, some other data that we've released and research pieces that we have out is our metaverse report. We released that a couple years ago that really captured where students create community, how technology informs and shapes the way they think about their mental health. And it really gave us a nod to what our US Surgeon General was saying around, we have to really make sure that we focus on and pay attention to how technology impacts student mental health. And by technology, I'm thinking about two dichotomies. I'm thinking about tech that helps mental health, so how students receive services, because not everyone can or wants to go in person for services, but they need access. I think about our partners at Crisis Text Line and 988 that are doing the hard work of dealing with in-time emergencies. And then I think about social media. As you all, if anybody watches the news, even for 2 seconds, and I encourage at least 2 seconds of news watching every now and then. Currently on the Senate floor, there is a vote around banning TikTok. And wherever you land on that kind of conversation, the way Jed has been thinking about it and looking at it is, okay, if it is banned, where will our students go that find a lot of community on those platforms? And if it's not, how do we ensure that we have parameters and guardrails to ensure that those social media platforms remain a safe space for our students? Because what we do know is that if we don't have guardrails on those platforms and our students go out looking for help or in distress and are researching things around harm and they have quick access to that, that also further exacerbates a lot of the issues. So from a federal level, what we've also been watching are some federal pieces of legislation, including the COSA Act, the Kids Online Safety Act, which Jed, along with a bunch of other advocacy orgs, have generously and readily endorsed, because we want to make sure that wherever our students gather to find information and to find community, that they find safety and accurate information around mental health. And I think that's really important. And I'm so glad that Dr. Patel is with us to talk more about some of the direct investments that our government and our government agencies are making to expand across those resources and resource sharing at where we find our youth finding community.
Yeah, one of the things we love about the learning community work that's happening with the Trellis Foundation and the community colleges, and universities that are working together is, higher education is probably best seen as a place that loves the case method. And the case method is copy and steal everything, right? If other people are doing it well, you got to figure out how you pull it in and leverage it. We really like models and playbooks and evidence. Evidence helps you get to that early majority. Playbooks help you get to that late majority and really get people doing this little larger work. but it is about a combination of how do you create responsive resources to people who are in distress or trauma, but also how you get upstream and create more proactively healthy environments so you have less and less of the kind of larger issue. Sunny, as you've been doing this work, I know one of the things you try to do is to be catalytic and bring people in. Like, I'd love to hear, who else are you working with on this that has been helpful, and who else should be in this conversation, especially if we're going to make a systemic difference on this kind of issue?
Yes. So I think it requires lots of partnerships, right? The work that we do doesn't happen alone. I think of the various partners that we have, particularly our partners at Department of Education are sort of, we're in lockstep there to be able to make sure that the programs that we're sort of pushing forward are in alignment and really advancing student wellness and mental health. I think a couple of things that we've been thinking about as it relates to how do we sort of expand our impact is how do we take a public health approach? And so it's not, you know, if the previous stats that we looked at, you know, if 40% of young people in higher education are feeling depressed or anxious, we're not going to treat our way out of this, right? Like, the workforce challenges are so dire. You know, you all know this probably even more acutely than I. That the lead time to produce a child psychiatrist or an adult psychiatrist, it's like 10 to 15 years, right? We need people now. We need resources now, right? And so, how do we use a public health approach? You know, that I think, as you're alluding to, sort of creates healthy environments, right? And to be able to do that public information work, like, I think that's really important, all the way to the responsiveness to high acuity needs. And so, for example, you were alluding to our 988 work. It requires partnerships. It requires partnerships at the state level. It requires partnerships with civil society in lots of different forms to be able to help spread the word that this is a resource that we're able to push forth. And then I think the third piece of sort of partnerships is how do we generate the appropriate evidence base, right? And I think that requires partnerships with universities, for universities, right? In the ways, where does knowledge get generated? Of course, you know, many of the institutions that you work at are the incubators for said knowledge. And we do that in partnership with our colleagues at the National Institutes of Health and particularly mental health. But all of that to say, this work can't be done just by SAMHSA or just by HHS. It requires partnerships sort of across multiple sectors.
Yeah, when you think about the challenge of getting any kind of collaboration between organizations like SAMHSA and HHS, DOL, DOE, and all the folks who actually, there's a lot of opportunity to coordinate and connect, and then you start bringing in the states and start thinking about how the state policy framework, and then you start thinking about institutional policy and like how boards are creating environments that are either, you know, positive or negative in this regard. Talk a bit about what you're seeing, like what has you hopeful about what's happening and what probably needs to happen to better coordinate the federal, state, and institutional policy environment, because so much of this is we have to think about it from the direct treatment or fostering of better healthy environments in institutions, but we create these systems we have either are going to be helpful or they're going to get in the way.
Yeah. I mean, it's clear that there needs to be work happening at both levels. I think that feels like the easy thing to just agree on. You know, there needs to be work happening at the federal level and then work happening at the state level. You know, with the federal level creating that broad legislative framework that allows us to then be able to think about it from a state and local perspective and sort of adapt what is being seen, you know, at the national level, at the state level. So, you know, that's definitely something we all have agreement on. But I think the piece that's really interesting with our learning community is we're realizing that there are a lot of shared commonalities across states. You know, many of them are coming to this work realizing that the silos that they see at institutions are replicated at the state and system level as well. You know, there are many folks working within this area, but often they're not sitting at the same table and engaging with each other. So that's been a big theme that's come up in our learning community, where states are really identifying that they need to be broadening the table, bringing as many folks into the conversation to be able to actually make sure that the limited resources are being used effectively. The other piece that's really interesting is, I think, we've often talked about how states are these engines, these laboratories to be able to, look at what innovation is taking place in that unique context, but then have all of these broader lessons that can be implemented and, best practices identified nationally. And we're seeing with our learning community states, there are a lot of lessons that they've identified that are working very well in one context. That might not work in the exact same context, but when you tweak that best practice just a little bit, you're able to implement it in a different context and apply the same lesson. So I think there's a lot of coordination that is necessary and intrinsically challenging because of just the ways our systems are set up. But we've continued to be really engaged with sharing updates with the Department of Ed, filling them in on our learning community states, but then also broadly collecting information from our membership of all 50 states on what they're really doing within these areas and challenges that they're identifying. That's also intrinsically related with funding, which is a big piece, right? We need to be thinking about sustainability of funding models and really identifying that this work doesn't start in our learning community and then stop right there. We need this work to continue, and that coordination between state and federal is so key to that sustainability piece.
Yeah, and it gets so complicated because we suddenly have very good-hearted policy initiatives like, hey, we're going to have initiatives that you get more funding as students accelerate.
Yeah.
For some students, accelerating while they're working and taking care of 3 kids might blow the system up for them, right? So it's figuring out what are the impacts of some of these policy mechanisms that we're putting in place and really analyzing this and figuring out how do we, again, make sure we're creating environments that not only help more students succeed, but actually don't blow up the life strategies of a lot of the students or life situations of a lot of the students that we're kind of working with, especially non-traditional working and military
Definitely.
students. Which is increasingly the majority in higher education. If you have non-traditional working and military students, the context really matters. So many of them are parents, so many of them are working at a full, it's a harder path. And just bear with me for a second. Close your eyes. Just close your eyes. I want you to picture a college student in your mind. Just picture that college student. Look at that student up and down. Now open your eyes. How many of you, when you were picturing that college student, were thinking about construction worker, a deployed soldier, a pregnant woman with 2 kids beside her? Like, I'm saying that because I am positive what your picture probably was. What was your picture? Probably an 18 to 20-year-old with a backpack over their shoulder, and the traditional model. And I'm just saying that because that is the dominant model, even though that is not the modal higher ed student. The living on campus, going full-time, not working student is 20% of higher ed. But that is all the conversation that you end up, especially when you're thinking about policy environments. So part of what we have to think about is just reality therapy of the students we have. It's having empathy. Like for the student, you can't redesign a system if you don't have empathy for the actual students. So Zainab, as we're thinking about that redesign, given the evidence that you're seeing and the projects you're working on, what are some of the big things we should be advocating for that are going to actually kind of drive change?
Absolutely. So what I appreciate in that framing is that figuring out how to shift our access and our traditional thinking around what today's student actually looks like. And this is work that I know Lumina Foundation has heavily invested in and focused on over the years. So we're having those conversations. I also want to say that some of the opportunities that we have go beyond funding. Yeah. This is coming from a non-for-profit, so I'm not saying money isn't important in this work. But if you all remember, right at the end of the pandemic, several states, governors were having millions upon billions of dollar investments in portfolios just dedicated to mental health. And part of what sparked the partnership between SHEEO and Jed was finding out that states, once they inherited their percentage of the billions or millions that were invested in mental health, didn't really know where to invest in. Yeah. What practice should we be expanding? What use case exists? Even when we talk to our federal partners from Ed and from HHS, what state use case example do we have? And so to level set, what I need us all to understand is that we are in a really unique moment. It's not just only a window of opportunity to really address an issue. We're literally building as we climb, right? So I won't have you close your eyes again, but when I say stigma did a number, imagine not talking about something for 10, 20, 30 years, and then talking about it on Monday and wanting a solution with back data by Friday. That's where we are. That's where we are. And the nerve of the policy window to not be permanently open. Because for those of us that work in policy, we know that these windows don't stay open forever. Okay? So setting that context, the hope that I see and what I see as a real strategy is ensuring that, number one, that we understand that different students need different things.
Right.
Okay? So when we think about adult students, when we think about rural students, when we think about minoritized students and communities, they need different things. Some of that looks like representation. Some of that looks like an expanse in how we evaluate our students and culturally responsive care, and not turning away from those opportunities to serve students and meet them where they are at. Another opportunity is to ensure that from a systemic approach, and we're finding that from the states that we're working with, is to engage non-traditional stakeholders.
Yeah.
So what's funny is that just 2 years ago, higher ed considered itself a non-traditional stakeholder. The conversation was, why are we in this? How are we in this conversation?
Yeah.
And for a lot of us advocates, we flagged like, hey, because you gather quite a large percentage of our nation's youth. So you might want to know how to respond to what they need, right? At the systems level, we're thinking about directors at the Board of Regents. We're even thinking about, from the licensing perspective, our licensing boards. So as Dr. Patel had mentioned earlier, with there being such a long trail in building out the workforce, how do we shorten that trail without giving up quality of the practitioners that we launch into this space? And what's exciting, I'll just mention this because I only learned about this week, AmeriCorps just announced a mental health pathway where there will be opportunities for students to be recruited right out of high school, right out of college, to join AmeriCorps, to join a mental health pathway. And those of us that know AmeriCorps, they have been, for a lot of us, the backbone of ensuring that our workforce is diverse and folks have opportunity to get key technical training. And looking from a social determinants of mental health model, just looking at Dr. Ruth's work, having that be the foundation and carving mental health as a foundational practice and throughway across our society is really, really pivotal and key. So I see all of those things and those strategies working in tandem.
Yeah.
And then at the programmatic level, I cannot emphasize enough how important it is to create cultures of care. And beyond working on behalf of students, a lot of our work at Jed also includes informing practitioners that are student-facing to know how to look for signs of crises, how to establish means reduction on campus, how to elevate students that normally do not know how to advocate for themselves. And to take it a step further, what we've learned in doing this work is that for our student-facing practitioners, faculty, staff, and otherwise, when they come from cultures and generations where stigma was so hard pressed, that's where we're really getting the pushback. It's that our faculty are saying, we're not okay either, and we don't have the language for that. So how do you expect me to help these students? Not that they don't care, but they just don't want to cause any further harm. And so I think it's a part of the practice is to ensure that the folks that are serving our students are also supported with the resources they need, not only to just serve the students, but to get the help that they need for their mental health.
Yeah, and
Can I add one
I
comment?
love the, go ahead, jump in.
Oh, just quickly, I think I really appreciate bringing up AmeriCorps here. I think one of the, we could use your creativity and
Right.
have this be bidirectional in what are these sort of innovative solutions that don't sort of perpetuate just what business as usual, right? I think as you've sort of been referring to, we didn't get to this moment yesterday, right? Like, sort of my kitschy line is we're in an acute on chronic crisis, right? It didn't happen yesterday, and so if we expect immediate solutions, there might be something we all missed, right? It's possible, but it's unlikely. I think there are interesting innovations. So the AmeriCorps example is really fascinating, and we're in touch with our colleagues there as well. The public health corps work came out of the COVID-19 pandemic of we need to rethink how we're sort of building the workforce to address public health needs. And the mental health corps as sort of an offshoot there is a really important piece of this as it relates to how do we help build and sustain the workforce that we might need to be able to help deliver care. Similarly, there are other programs across the federal government that we have to support the mental health and well-being of folks that we're training. So one is producing the workforce, the other is supporting the workforce. And so, for example, the Department of Labor runs a really important program called Job Corps. Yeah. And how do we help support the mental health and well-being of folks that are going through Job Corps? And we're providing all the other support. We really need to, double down on the mental health supports. And so I just wanted to sort of draw a fine point on this is something that we have our eye on as well.
No, and these conversations, I mean, in terms of us rethinking the design of everything from our institutions to our kind of broader societal supports to the policy frameworks that roll in really matters, because there are some root metaphors and or root conceptions that we just need to face pretty hard. Because for example, in the world of education, I will charge that there is not a privileged parent on the planet that it does not spend a lot of time thinking about making sure their child is in a healthy learning environment. They spend a lot of money, they do a lot of research, and if anything goes wrong in that environment, they swoop in and they provide the scaffolds to be able to help that person survive. And unfortunately, in a lot of our more distressed communities, the model tends to be Darwinian. And it tends to be like it's designed where students are really kind of survival of the fittest. And many folks in the world of education have been brought up with that idea of look left, look right, and half of you won't be here at the end. And that was almost seen as a badge of honor. Yeah. And we just need to say that out loud. We still have people in our institutions that feel like that was the right way to do it. And they're like, well, I survived, you should survive too. But that root metaphor is brutal. Because it is really difficult to say, no, actually we're leaving a lot of highly talented, capable people that we really care about behind. And not to mention, it's the fact that the people who are surviving are often the people who are scaffolded. Correct. And the people who are from second, third, fourth, fifth generation families are heavily scaffolded by people who've done it before. What we need to think about is, and I love the idea of saying not all supports are the same, is what scaffolds does that person need? And I love the metaphor of scaffolds because they go away as that person becomes stronger, right? It's like, what do they need in that moment to kind of get them where they're going to go? Right. As we take on this work, I'd love for each of you to maybe talk about this a bit and maybe build on each other, is what is some of the most important work that folks here should be thinking about? What should they be doing? What should they be advocating for? What should they be catalyzing in their context? Because you have a mix of educators, policymakers, nonprofit folks who are here, but like if they're going to go back and talk to somebody about how do we kind of drive this conversation to kind of make it better for the students that we care about, what should they be focused on?
I would say you started this, so I'm going to continue that thread, but this is everyone's job. This cannot be one person's job. This needs to be everyone's job. I think one thing that has come up in the learning community that was just very reassuring for me was, when I had started to be really interested in the student mental health space, it was pre-pandemic, it was January 2020, was work trying to engage provosts and presidents in thinking about faculty and staff mental health. No one wanted to talk to me. 2 months down, everyone wanted to talk about this project. Suddenly, all of these calls were coming in where everyone was saying, we were thinking about student mental health, but we never thought about our faculty and staff. That is something we need to be thinking about, right? So I think just considering this to be a key component of everyone's job is so important for us to be able to create that culture of care in our campus, in our society generally. And I think there are sort of clear tactics that one can implement very easily. We talked a little bit about sort of what is necessary from a funding perspective, but there are other things to be done in the academic space that can create that culture. Small things like faculty actually having flexibility in their curriculum to be able to acknowledge students that need accommodation. Deadlines being open-ended. I think when it also comes from the point of view of us thinking about how faculty and staff are often the first responders to supporting students in distress, but don't have the tools, don't have the skills to be able to, actually step in and intervene and do that in a mindful way of recognizing their own needs as well. So it's really embedding that as a core function of our higher education ecosystem and ensuring that everyone is really invested in that from a perspective of supporting themselves and everyone else around them.
Love that. What do you think?
Absolutely. Tough act to follow, Sakshee. Thanks for that. I think one strategy that we definitely have to lean into is ensuring that we understand the burden of care that we have as leaders on campus, as faculty and staff. Some of the earlier conversations I remember having with faculty in particular, and by early I mean in the after times in early 2020, was our institutions, because we hadn't taken on mental health as part of like our burden of work or care, weren't even really aware of what resources existed in the city that your institution is situated on. So then our thought, as I understand, because I'm an academic myself, our thought was misplaced. Our judgment was that we had to solve all of the mental health issues in-house within our 4 institutional walls, and if we couldn't solve it, then I don't know, we got to start research from ground up and get funding and institutional funding for that, and then wait for the data, and then implement the solution. When in reality, creating opportunities for collaboration with your local emergency hospitals, having therapists on retainer, especially when your counseling centers, according to the AUCCCD, are already overwhelmed. I mean, even in larger flagship institutions with full, robust counseling centers, we know, like the secret is out, y'all. The magazine has been printed. The headline is, you cannot serve the demand that is actually on your campus. And that does not mean you get to look away and say, well, first come, first serve, survival of the fittest, get in where you fit in. If you didn't make the office hours, we can't help you. The burden of care is now, what relationships do we have that we can refer students to? And I'm speaking as, again, an academic director that, as a therapist, I remember at one time I had to pull my department chair aside and go, hey, is anything I'm doing illegal? Because I'm finding a lot of students referring their friends to me, and then I had to work with parents to get them out of my office because I wasn't hired here to practice, but here is a list of resources right off campus to get you triaged, to get you assessed, and to get your needs met. And then again, I think that there's a really important point to be made about legislation and a lot of opportunities that we have to bring things to scale. Good policy brings good practice to scale for everyone, right? But we can't legislate a lot of this away. And I learned that from a summit that we hosted last year, that legislation alone without translation into practice is just like a pretty mission statement. States, you can do this, but we have to figure out ways to create partnerships in practice. And so doing so means having clearer lines between our Board of Regents, between our state folks and folks on campus to have clearer conversations about what our individual institutions need and where we can bond together to make sure resources are available.
So much goodness in that conversation you just laid out there. And I think one of the biggest ones is just the imperative to braid our resources. Figure out how we bring what we can do and figure out what are the surrounding resources that we can braid in, whether it's funding or actual kind of human support within this work. What do you think, Sunny?
I have the great misfortune of being the third in line. So I'm going to just make a couple of things up and then we'll riff. I'm just kidding. Hopefully it'll be, I think it's all additive. I really like scaffolding because I also think about scaffolding, and I think we probably all unconsciously or consciously use heuristics to make sense of the world, right? We're simplifying things and trying to figure that out. We should go back to first principles. So I have 3 points. I use the rules of 3. We should have a broader frame. We need to be using a sort of socio-ecological model when we think about people, right? When we think about students. And I think it's really important to understand the social context. It's important to understand, the geography, like, the rurality versus not. Like, there are so many sort of these concentric circles that affect each individual. And I think that's where the adaptation piece is really important, to understand like what are these contextual factors that you need to account for in the communities, right? Because there might not necessarily be a one-size-fits-all piece there, but and so I think that's really important. I think the second piece is it's sort of building upon, what's the robust continuum of services that we're able to provide, right? So one is assessing what are you able to provide in current state, and then what's a future state look like, right? Like what's the magic wand exercise, and then how do we bridge that delta? One of the fears that I have is there's kind of an appification of mental health. Like we don't have the resources, here's an app. There's like 10,000 like wellness and mental health apps out there currently. I think if I feel, and this is not the official position of the Department of Health and Human Services.
Nobody tweet that.
But it is, as a clinician and as someone who works on mental health policy, I do think we need to be careful that it's the panacea. It's sort of the easy button of like, this is how we're going to fix the issue around building out the robust continuum of services. It can be a tool, but it can't be where we rest all of our resources, right? And I think being judicious in how we're doing resource allocation there is really important. And then the second point there is understanding what works, right? Because the burden should be there in trying to understand the resources that we're providing. Do we have an evidence base around what works, or do we need to help build it? One thing we're really proud of in helping build the continuum of services is we've extended telehealth flexibilities from HHS through the end of this year, and knock on wood, we might be in this new, I like to call it the new abnormal that we're in, and perhaps some of these flexibilities may stay onwards, and I think people are really benefiting from that. We've heard that in public comment that we've put out. And then I'll end. The third piece is stigma. I sort of, I feel like we're in a new moment, and yet stigma still is this like ever-present sort of dark cloud. And I've seen this personally, working with students on college campuses, and the trend is quite concerning. Is folks who identify having mental health issues and might take leaves of absence have an extremely challenging time coming back. And we really need to think about how do we do the reintegration piece, how do we help provide the support so that people aren't afraid of seeking help. Like, I think in creating cultures of wellness, we need to, it can't just be in thought and word, it needs to be in deed. And like, what are the policies that need to be in place in your local institutions that help promote and folks reaching out for help, but also that provide that wraparound support.
I do think the admonition that people are really beginning to embrace is that there is no health without mental health.
That's right.
Right. The idea that there is no health without mental health has really come to bear, and hopefully we're taking on that stigma in a pretty big way. I also am pretty encouraged, if you haven't read the Hans Rosling book, which was his last book before he passed, a kind of international futurist, and I think it was called Factfulness, where he talks about being a possibilist. I've always embraced, instead of normal or new normal, or new abnormal, I embrace the notion of a new possible. We should be working together to create a new possible and figuring out how we're going. Okay, rapid fire. Any quick admonitions for Trellis Foundation as it continues to try to catalyze this work? So I know you get to go first, because I don't want to put you last again.
We rely on the work that folks do on the ground, and so where we can be doing better as a federal government, we are a government for the people, by the people. Please be in touch and tell us what's not working, right? We want to hear that. Tell us what new possibilities exist that we might not have our eye on. I think this is a unique opportunity where I have no pretension that we have all of the solutions. And in fact, I know where my blind spot is. From my perch in DC, I can't know what the needs are in Amarillo, right? Just by virtue of geography. And it requires talking to folks and being present in community with folks to be able to learn that. And I also read all paper that comes my way, and so like the reports that Trellis puts out, that Meadows puts out, that Jed puts out, I read them all, and so they go somewhere, and I think that's really important.
That's fantastic. Well, Kristen already said you're her new best friend, so you're on speed dial. You're going in right there. Go ahead.
So I think that the work that Trellis has done and invested in is just phenomenal. I do want to reiterate to this room and to everyone that's a mental health advocate that we are really in a unique time, and we can't take for granted the moment that we're in. So continue to lead with a sense of urgency, because again, the work that we're literally living in right now is building out the framework so that when that policy window does close and the next thing does take our national attention, that when we go back to look at what we've done for mental health, we're not having to start from the ground up, or we don't close in on each other as we're doing this work. And I also think it's important to just mention that all students, no matter their background or where they find themselves on the traditional student, non-traditional student pipeline, deserve quality and equitable mental health care. And so keeping that at the center so that as we're thinking nationally about how we're moving the needle, particularly around suicide prevention. And remember, suicide on the spectrum of healthcare is like our bottom. We want to bring suicide to zero, right? But beyond folks that are struggling with suicide, there are wellness continuums that we're thinking about too. We also want folks to have a quality of life and good wellness practices as well. So we're having a larger breadth of a conversation that's really exciting to have and can feel like a lot of minutia because it is, but we're doing so because we recognize that the time is here and now to have this conversation. So Jed is here to partner with institutions. Please definitely check out our impact report, and we look forward to partnering with you.
Love it. Sakshee.
Tough to be the one saying the last words as we wrap up, but I would say, what I've really appreciated about the Trellis Foundation is just broadening the table, bringing more and more stakeholders into the conversation. I think that's evident even with our Texas team that's a part of our learning community. We recently had a reflections check-in, and it was wonderful that a team that is already the biggest in the learning community has identified new partners in this work. And I think that's exactly what we need to be doing, is making those connections, identifying folks within our states, our systems, our institutions that are doing this work, and bringing them into that space. I think this room is a reflection of that as well, and I think we need to continue to making those connections so we can really actually advance student mental health from a holistic perspective instead of it being siloed like it always has been.
Just to wrap it up, the folks who do this work will tell you that one of the biggest challenges for folks who care about trying to change the trajectory for mental health is something called emotional contagion. And emotional contagion is when the people who are the caretakers don't take the time to take care of themselves, and they actually can fall prey to some of the exact same issues. As the son of a nurse, I saw this firsthand with my mom. I will say, just in closing, one of the ways you combat emotional contagion, or the set of ways, and I'm going to use the rule of threes, is one, you know it exists, and so you call it out, and you're aware of it, and you're paying attention to it. And two, as you're doing that, you make sure you engage the strategies that are going to help you, because it is not a gift to a thirsty person to give them an empty cup, right? You got to take care of yourself and make sure you're doing that. And then third, one of the best ways to make sure that we're showing up strong is that we show up together. So if we can lock arms, learn from each other, that's why these learning communities are so strong. It is super important because we will be better together. Let's give these folks a big round of applause.